Hello, today I am going to presenting on the classification in psychiatry, need and types. Classification in psychiatry is the process of organizing complex mental phenomena into systematic categories, classes, or groups. The main goal of this process is to bring together mental disorders that share similar features and to distinguish them from those that differ. This helps in identifying, understanding, and treating various mental disorders more effectively. Psychiatric classification provides a scientific framework for diagnosing mental illness. Since mental health conditions often present with overlapping symptoms, classification symptoms help clinicians and researchers communicate using a common language. The most widely accepted systems of psychiatric classifications are the International Classification of Disease ICD-11 developed by the World Health Organization and the Diagnostic and Statistical Manual Mental Disorders DSM developed by the American Psychiatry Association. Let's talk about the need for classification. First one, the classification of mental disorders has several essential purposes. First one is to enable communication regarding diagnosis. A standardized classification system allows mental health professionals across the world to communicate clearly about a patient condition. It ensures that everyone refers to the same disorder using a common diagnostic term, thus reducing confusion. Second one is to facilitate understanding of underlying causes. Classification helps in grouping disorders based on their symptoms and possible causes. This understanding allows professionals to identify etiological factors, biological, psychological, and social that contribute to the disorder. Third one, to gain in prediction and prognosis. By categorizing disorders, professionals can predict the likely course, outcome, and response to treatment. This assists in planning suitable interventions and rehabilitation programs for the patient. Now let's talk about the categories of classification. There are two major systems used for the classification of mental disorders. First one is ICD-11. ICD stands for International Classification of Disease. It was developed by the World Health Organization. The ICD-11 provides a global standard for diagnosing all health conditions including mental and behavioral disorders. It is used worldwide by health professionals for reporting and clinical management. Next one is DSM, Diagnostic and Statistical Manual of Mental Disorders. It was developed by the American Psychiatry Association, provide detailed diagnostic criteria for each mental disorder. It is widely used in clinical, academic, and research settings, especially in the United States and Western countries. Both systems classify mental disorders based on observable symptoms and behavioral patterns, ensuring reliability and consistency in diagnosis. Now let's talk about the placement in classification. In psychiatry, mental disorders are broadly classified into two major categories based on the severity of symptoms and the person's connection with the reality. First one is neurotic disorders, second one is psychotic disorders. Neurosis is a group of functional mental disorders that involve emotional distress but do not include delusions or hallucinations. In neurosis, the individual remain in touch with reality and their behavior generally falls within socially acceptable norms. Psychosis. Psychosis, on the other hand, refers to a severe mental disorder in which the person loses touch with the reality. In psychosis, the individual's perception, thinking, and judgment are severely impaired. When it comes to the neurotic disorder, there are milder forms of mental disorders. The individual experience emotional distress, anxiety, or fear, but remain aware of the reality. Examples include anxiety disorders, phobic disorders, OCD, obsessive compulsive disorder, and depressive neurosis. In ICD-11 and DSM-V, these are included under categories like anxiety and fear-related disorders, obsessive compulsive disorders, and somatoform disorders. Psychotic disorders. These are severe mental disorders where the person loses contact with reality. They may experience hallucination, delusions, and disorganized thinking. Examples include schizophrenia, bipolar disorders, schizoaffective disorder, psychotic disorders. In ICD-11 and DSM-V, they are classified under schizophrenia spectrum and other psychotic disorders. So, comes to the conclusion. Classification in psychiatry provide an initial framework for diagnosing and managing mental disorders. Systems like ICD-11 and DSM-V ensure uniformity and scientific accuracy in identifying various conditions. Understanding the difference between neurosis and psychosis is crucial as it helps professionals determine the severity, treatment approach, and prognosis of mental illness. Thank you.